How to treat and cure juvenile diabetes. Diabetes, also called diabetes mellitus, has become a very common health problem. There are two main types of diabetes: type 1 diabetes, in which the body does not produce insulin, and type 2 diabetes, in which the body does not produce enough insulin, or the insulin that is produced does not work properly. Some of the common symptoms of diabetes include fatigue, weight loss, even though you are eating more, excessive thirst, increased urination, cut and bruises that are slow to heal, and blurred vision. While there is no cure for diabetes, with your blood sugar level under control you can live a totally normal life. There are various natural remedies for diabetes that will help you control your blood sugar level. Treating type 1 diabetes. There's no cure for diabetes, so treatment aims to keep your blood glucose levels as normal as possible and to control your symptoms to prevent health problems developing later in life. If you've been diagnosed with diabetes, you'll be referred for specialist treatment from a diabetes care team. They'll be able to explain your condition in detail and help you understand your treatment. They'll also closely monitor your condition to identify any health problems that may occur. Insulin treatment. Type 1 diabetes occurs because your body can't produce enough insulin. This means you'll need regular insulin treatment to keep your glucose levels normal. Insulin comes in several different preparations, each of which works slightly differently. For example, some last up to a whole day, long-acting, some last up to 8 hours, short-acting, and some work quickly but don't last very long, rapid-acting. Your treatment is likely to include a combination of these different insulin preparations. Insulin injections. If you have type 1 diabetes, you'll probably need insulin injections. Insulin must be injected, because if it were taken as a tablet, it would be broken down in your stomach, like food, and would be unable to enter your bloodstream. When you're first diagnosed, your diabetes care team will help you with your insulin injections, before showing you how and when to do it yourself. They'll also show you how to store your insulin and dispose of your needles properly. Insulin injections are usually given by an injection pen, which is also known as an insulin pen or auto-injector. However, injections are sometimes given using a syringe. Most people need 2 to 4 injections a day. Your GP or diabetes nurse may also teach one of your close friends or relatives how to inject the insulin properly. Insulin pump therapy. Insulin pump therapy is an alternative to injecting insulin. An insulin pump is a small device that holds insulin and is about the size of a pack of playing cards. The pump is attached to you by a long, thin piece of tubing, with a needle at the end, which is inserted under your skin. Most people insert the needle into their stomach, but you could also insert it into your hips, thighs, buttocks or arms. The pump allows insulin to continuously flow into your bloodstream at a rate you can control. This means you no longer need to give yourself injections, although you'll need to monitor your blood glucose levels very closely to ensure you're receiving the right amount of insulin. Insulin pump therapy can be used by adults, teenagers and children, with adult supervision, who have type 1 diabetes. However, it may not be suitable for everyone. Your diabetes care team may suggest pump therapy if you have frequent episodes of low blood glucose, hypoglycemia. Monitoring blood glucose. An important part of treatment is to make sure that your blood sugar level is as normal and stable as possible. You'll be able to manage this using insulin treatment and by eating a healthy, balanced diet, but you will also have to regularly check your blood glucose levels to make sure they're not too high or too low. Exercise, illness, stress, drinking alcohol, taking other medicines and, for women, changes to your hormone levels during your monthly period can all affect your blood sugar levels. In most cases, you'll need to check your blood glucose levels during the day, both at home and at work or school, using a simple finger prick blood test. You may need to do this up to 4 or more times a day, depending on the type of insulin treatment you're taking. Your diabetes care team will talk to you about your ideal blood glucose level. The normal blood sugar level is 4.0 to 7.0 millimoles/L before meals and less than 9.0 millimoles/L 2 hours after meals. Mol/L means millimoles per liter, and it's a way of defining the concentration of glucose in your blood. Type 1 diabetes can lead to long-term complications. If you have the condition, you have an increased risk of developing heart disease, stroke and kidney disease. To reduce the chance of this, you may be advised to take antihypertensive medicines to control high blood pressure. A statin, such as simvastatin, to reduce high cholesterol levels. Low-dose aspirin to prevent stroke. Angiotensin-converting enzyme, ACE, inhibitor, if you have the early signs of diabetic kidney disease. Diabetic kidney disease is identified by the presence of small amounts of a protein called albumin in your urine. It's often reversible if treated early enough.